In a lot of cases, even after we perform non-operative treatment interventions, I will have patients progress back into a course of physical therapy to help with additional guidance in terms of appropriate muscle strengthening, appropriate muscle mechanics to help make sure that patients are moving in a way that makes sense and moving in a way that's going to help them with their general function. Hey everyone, it's Dr. Jess Sally with Regenexx Pittsburgh, your Southwestern Pennsylvania premier providers of interventional orthopedics and non-operative interventional treatment. I usually use the analogy of replacing a tire on a car. If you put a new tire on a car, but you don't balance and align it, you run the risk of just wearing that tire out in the same way that it has been in the past. So when we utilize these treatments to help give people pain relief, we also want to help with making sure that their muscles are helping to move their body in a way that's going to make sense for them. For varying patients, people are going to be able to tolerate different levels of strengthening activity. What exercises work for some may not be the same exercises that work for others. That's why it takes a trained eye and a good evaluation to help with making sure that we're providing the appropriate exercises so that we can give you the strengthening tools that you need to move forward with the functional activity that you want to engage with. So while movement is good for joint pain, movement and appropriate movement, along with good strength, are what are optimally needed to make sure that you're doing the activity in a way that's not going to cause more problems down the road. So if you feel like you've been doing exercise and you've plateaued with being able to gain additional pain relief, go to our website and check out some of the additional treatments that we offer that can be very helpful for reducing knee pain, so that going back to physical therapy and continuing to advance your strengthening can only lead to improvements in your function and continuing to improve pain in your day-to-day life. I'm a big believer in strengthening. I'm a big believer in patient exercise. I'm a big proponent of the fact that good muscle strength and good muscle stability will also translate into better joint mobility and better joint stability. I want to try to help you to get to a place where you have better strength, where you have better functional strength to help you engage in the activities that you want to engage in with much more ease. And I want to be able to provide treatments that are going to help with reducing pain so that we can get people back to activity and get people stronger so that we can have better function as we go on in years.